Okay, and we have to start out by introducing ourselves. So I'm Haley.
I'm Erica.
I'm Allison.
I'm Melinda.
I'm
Hannah.
And I'm Jacqueline.
All right, so for our final presentation, we decided to combine a couple of case studies to get more of a basis for our slides and stuff. So my case study centered around how my parents got divorced when I was around 7 or in second grade, whatever. And my biological dad was using a lot of drugs and became violent and just abusive. So that kind of led up to the divorce. So we decided to combine that history of drug use with Amy's, and she's going to summarize hers a little bit.
Mine was about my brother that got addicted to cocaine when he was 19 years old, and is now living in a special home to get looked after. And with him using stuff, our parents got very depressed, and he became abusive to us. That's my story.
All right, so I'll start. Our PowerPoint is about addiction in the Netherlands and the US, and how our society in the US deals with it. They tend to push blame before providing assistance to the person that's addicted. Then after they push the blame, they initiate the person into treatment or rehab. Our society sees the addiction as an illness rather than something they get themselves into. And addiction is America's most neglected disease. 1 in 10 report receiving treatment who are addicted. And then 40 million Americans age 12 and over meet the criteria for being addicted. That's mine.
Who's next?
One of you two will have to read it since the other two aren't here.
I don't know what they had though. I haven't read it. We can read them and do this at the end if they come.
Yeah.
Okay. We can just skip over theirs for now.
Okay, so then we talked a little bit about the reaction to the situation that the United States has. So it's very common for the public to have social distance against people who have substance use disorders. They think that people are originally responsible for their disorder. However, they're viewed as more likely to overcome their conditions versus people with other mental health illnesses. People with mental health illnesses and our physical disabilities are more worthy of help than those with drug addictions, is what the public believes. Discrimination against persons with drug addictions is not a serious problem compared to other different disorders and disabilities. And people believe that employers and landlords should have the right to refuse drug addicts.
All right, the next sheet is for one of us, Group Ida. I think.
Okay.
Shall I read it?
Sure.
Reaction to the situation in the Netherlands. People with drug addiction are worth the same help as people with mental or physical problem disease. Discrimination is never allowed, also not towards a person with an addiction. There are businesses which offer jobs to people who are in treatment for their addiction and refuse somebody with an addiction, only in cases of bad behavior.
So the processes of hospitalization and rehabilitation vary for the U.S., vary based on the addiction and the severity, the treatment used, and a lot of other factors. But any addiction hospitalization kind of has the key elements of intake, detoxification, and detoxification can either be in an inpatient setting or outpatient. Normally it's inpatient because it can be pretty severe and can be pretty deadly. Rehabilitation which also could be inpatient or outpatient. And then ongoing recovery is kind of like a lifelong thing that they have for after they go through rehab.
Process of hospitalization and rehab in the Netherlands. The intake, the help from home, the social worker, hospitalization for detox, and the doctor needs to refer you to a clinic or organization.
So there's a number of ways that care occurs after discharge in the U.S. So drug rehab treatment programs typically arrange for ongoing addiction support during treatment and after discharge. So case managers will facilitate communication between the patient and providers. Plans should be modified based on a client-to-client basis because every client's situation and experience will be different. So outpatient drug rehab services are used to prevent relapse. After discharge from a treatment program, patients are still at risk for relapse and need a continuing care plan to ensure that they remain sober and seek help when triggers occur. Outpatient drug rehab services focus on coping mechanisms to stay sober, and services to ensure sobriety include outpatient services, group or individual counseling sessions, and 12-step meetings. Continued support with aftercare includes case management, referral to group, individual or family sessions, or drug testing. This can also be like organized social or recreational activities that allow clinicians themselves to assess patients in a real-world setting. Clinicians can help provide documentation to show the positive progress through these settings. And then attending alumni programs can assist in maintaining supportive relationships developed during the rehab treatment program and offers a way for clinicians to identify former patients at risk for relapsing. And lastly, former patients can serve as mentors for others in their early recovery stages.
All right, the next sheet is mine about care after discharge in the Netherlands. The aftercare provides services which will make transitioning into a new life with new habits and new ways of thinking more successful, with less risk of relapse. The aftercare is very important because people who come out of the clinic are hopeful and are changed, but unfortunately their environment isn't changed, so they have to adapt to fit in the normal life. This care lasts about 13 weeks, and family or friends of these persons are involved as much as possible to give them support. The therapy or the care consists of individual counseling, group meetings, addiction education, and social activities.
Okay, so in the US, when a person has a drug problem, they have a disease that can hurt the family. So drug use puts a lot of stress on parents, children, and other family members. Family members may fight a lot because of the problems the drug use is causing. My parents fought constantly due to my biological father's drug use, and his drug use led to emotional abuse towards my mother and bouts of rage, causing him to break things and yell. The person who's using drugs might do and say things that upset neighbors and friends and make the family ashamed. When parents use drugs, the children get hurt. My father's drug use led to my parents' divorce and caused my sister and I emotional harm that required therapy for many years.
Is it my turn?
Yep.
I also had the effect of my brother's drug abuse on the family. Well, as was just told, you get like a lot of arguments between parents. On my side, it was my parents argued because one of them did want to take him into rehab and the other one wasn't sure if that was a good idea. They argued a lot about it. My brother stole from us, like he stole jewelry, money, just anything he could to pay for his drugs. So me and my little brother sometimes got the blame of it, even though it wasn't us. sometimes arguments can turn into fights because my brother was mental ill as well. So even if you said something normal, it could just turn and it'll just like hit someone. So that was very difficult for the family. And and if you have a child that is like sick and needs all of the attention, your parents like focus on one child and like let the other two children just be because they know that they have to focus on that one child. So that was also very difficult for me and my brother. And that was about the effect on my family.
So overall, we found a number of similarities between the Netherlands and the US related to addiction. And we discovered that through our different case studies and through our personal research as presented in this presentation.
Mm-hmm.
Good job, everybody.